Hello everyone! After deciding to seek therapy, you may have come across the different forms. You've probably heard or read something about psychodynamic therapy, CBT, DBT, systemic, holistic therapy, and some more. To not confuse you any further and provide clarity, I'll give you a brief overview of the therapy forms, how they work, and how to decide which one is the right one for you. A quick disclaimer before we start. Every therapy form has its benefits and shortcomings and is useful in its own way. I personally don't think that one form is better than another, but that one form is better suited for some people than for others. It all comes down to your own openness for therapy and what you expect from therapy. So for your understanding, there are 4 major therapy forms which can be divided into smaller subforms. The first therapy form I want to talk about is psychoanalysis or psychodynamic therapy in general, because that's the therapy form I practice. Psychodynamic therapy emphasizes how certain relationships and life events in both past and present affect your current relationships, feelings, and your choices. Its goal is to help you understand and acknowledge repressed emotions and negative feelings so you can resolve internal psychological conflicts and improve your relationships, self-esteem, and life choices. As a psychodynamic therapist, I encourage my clients to speak openly and as freely as they can about a range of issues to help them uncover different experiences, memories, or even dreams that helped shape their lives. At the same time, we analyze the underlying resistance, which means the client's attempts to avoid confrontation and anxiety-associated topics. Since we also always keep an eye on the transference, that means the client's projection of inner feelings and thoughts onto the therapist, we constantly also talk about our therapeutic relationship. A psychodynamic therapy mostly takes more than a year to achieve enduring benefits, although sometimes it can be an effective short-term therapy. So if you want quick alleviation of your symptoms, this therapy form may not be the right one for you, but it's a highly rewarding one since the effects are for the long term and you will gain a deeper understanding of yourself and your symptoms. The next big and probably best known therapy form is cognitive behavioral therapy, or CBT in short. CBT is a short-term, goal-oriented therapy that focuses on the link between our thoughts, or cognition, and our actions, or behavior. It is based on the idea that how we think about situations can affect the way we feel and behave. For instance, if you interpret minor turbulence in an elevator as a catastrophe or the herald of death, you might experience negative emotions like angst, and that might lead you to behave in a certain way, for example to panic. Therefore, in CBT, you and your therapist will identify negative thought patterns and behaviors, agree on activities to work on outside therapy sessions, and sometimes also confront yourself with unpleasant activities. CBT is suited for people who want to have some more hands-on practice, manuals, and quick alleviation. However, it might not be that satisfying if you are looking for a deeper understanding of your problems. A subform of therapy based on CBT is the Dialectical Behavior Therapy, or in short, DBT. It's adapted for people who feel emotions very intensely with the aim to help them understand their difficult feelings, learn skills to manage them, and become able to make positive changes in their lives. They also learn to handle stress in a healthy way, live mindfully, and improve their relationships. It was originally developed for people with borderline personality disorder with self-harming behavior or behavior endangering others and interpersonal problems. Therefore, it might not be right for everyone. DBT requires you to do some sessions in a group with others and focuses mostly on your present and future rather than your past. Another one of the major therapy forms I want to present is the systemic therapy, which focuses on the individual in the context of their relationship with others. A person is not to be seen isolated, but as a part of a larger unit or system, such as a family, organization, community, or couple. In systemic therapy sessions, you and your therapist will try to identify the deep-rooted behavior and communication patterns within your relationships and family members. It is about understanding your unhealthy relationship dynamics, or repeating patterns by doing family constellations and even sessions with your partners or family members. The last therapy form of forms are the humanistic or holistic therapies, such as client-centered therapy, gestalt therapy, and psychodrama. The humanistic approach is based on the assumption that every person has the capacity for self-healing, problem-solving, and personal growth. It required the therapist to be empathetic, authentic, and non-judgmentally accepting. The therapists put themselves into the emotional and mental world of the affected person and give non-judgmental feedback. No interpretation comes from the therapist in humanistic therapies. Psychotherapy aims to help patients learn to understand and accept themselves. Depending on the subform, the exploration of feelings and experiences can be managed through role plays, reenactments, exaggerated movements, and other exercises. The aim is to provoke or arouse emotions in different situations, allowing you to become aware of them and understand them as they arise. As mentioned earlier, no therapy form is better than another, but better suited depending on yourself. It really comes down to your expectations and general approach to life. If you already have experience with one form or another, let me know in the comment section below. But if you still haven't decided whether you need therapy or not, check out my last video on the 5 signs you need therapy. And as always, like, subscribe, and enjoy your day. Take care.